Hello, Dr. James Bogash, expert in health longevity, and in today's Beating a Dead Horse episode, we're going to talk about the impact of cardiorespiratory fitness on COVID and why 4 years later we're still deftly avoiding this conversation. Before we go on, though, make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel. That being said, for the entire pandemic, and there are still people who definitely think that the pandemic is still in full swing, Twitter is an ugly place, and lots of people on there still are living in that world. But I have, since the beginning, argued that the only thing that would have made a difference is better metabolic health. Now, by that we're talking about diet, exercise, sleep, stress management. But if we just look at one simple component, cardiorespiratory fitness, how much of an impact did that have? And this had to do, so picture cardiorespiratory fitness. This can be measured by like a treadmill, like a cardiac stress test, where you are improving or increasing treadmill speed and measuring heart rate and everything and exertion. And so this was looking at, so overall the database was 750,000 people in the VA system. Of that, 23,140 of them were diagnosed were COVID-19 positive. This was from March 20th to September, or March 2020 to September 2020. So this was ancestral strain, which was arguably one of the more dangerous strains. So anything that could protect during this time was even more potentially powerful than it might have been with Omicron or any of the other versions. And what they found is that when they compared the least fit to the most fit, they were 46%, or the most fit were 46% less likely to die. That's a huge change. They also had reduced hospitalizations, reduced need for intubation, but here's the real kick in the ass, in that when they controlled for all these factors, whether somebody who was older, whether they had a high blood pressure, diabetes, cardiovascular disease, kidney disease, higher BMI, it didn't matter. Better respiratory fitness led to about a half of the risk of dying. I don't know how we ever got to the idea that we couldn't control the outcomes, because this little factoid, just exercise alone, has been very clear almost from the very beginning. And this is 4 years later, a study that very powerfully points to the fact that even just exercise and fitness alone can play a massive role. We're still not going to talk about this. We spent 4 years not talking about the overall metabolic health of the United States and why we did so poorly. It was all about this response or that response. We should have locked down. We should have done the vaccine. Should have been better. None of it, not a single bit of it really mattered if you didn't have better metabolic health. If you didn't, everything was a crapshoot. And if you survived, it was more likely that it was luck more so than anything else. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.